Hi, everybody. Welcome once again to our live podcast, The Only You, English version of Solutu, speaking about mental health issues, mental health, mental wellness, mental illness, and answering as many of your questions as we can. As you know, this is a live show. We'd love you to participate. Go ahead and type into the comments, and Dr. Patino will respond to the things you have to say. We'd love to, again, respond to those things live on air. I'm Vince. I'm in the studio, as you can see behind me, the Solo 2 studios, and Dr. Tino is in his office. How are you doing today, sir?
I'm doing great, thank you. How about you?
Getting there. It's been an interesting day. A lot of things going on, a lot of people's attitudes changing. In class today, I taught a class. I think I mentioned that. And it was really interesting to see how people are functioning a little differently with COVID changing, with the vaccination being out. But oddly enough, this is the first time I had a class where everybody wore their masks. Every single person, which is rare because usually you have those differences of opinion concerning it. But this time everyone was consistent with that, even though a lot of them did not have their vaccinations yet. Kind of an interesting view, right? The way people are functioning. Oh,
Hey, listen, I think we were having a little bit of problem.
and what is that? Can you not hear me?
I can I can hear you, but I'm hearing you twice.
Oh, okay.
I think that is better now. Can you hear me now?
I can hear you quite fine.
Okay, that's perfect. So I think we had a little bit of a technical issue, but I think that I have corrected it. I think that I have two programs going at the same time. So again, what is going to be the topic today?
Well, I think a lot of people's changing attitudes toward COVID, but also you've mentioned something over and over again the last couple of weeks, and that's the term neglect. You said once even that if you could wave a magic wand, you would get rid of neglect in the world. What is that?
Wow. I mean, neglect is probably one of the most damaging experiences that a child can have. And we normally talk a lot about abuse. We talk a lot about uh, kids being abandoned and things like that. But at the core of the child's experience when you're growing up with the idea that there's something wrong with you is something extremely negative. So kids get really damaged in their ability to develop a sense of value and developing a sense of self when they're neglected. So that's why when we talked in the past about, I mean, can we do something to help humanity in general? I think that we need to stop neglecting people. But I think that we can translate that also into people are being neglected every day and re-experiencing the idea that if I'm neglected, there's something wrong with me. We very seldom think about I'm being neglected and is their problem, right? Let me give you an example. This morning, I was talking to a girl in the hospital who came in because she was feeling suicidal, right? And she actually tried to kill herself. She took an overdose, a bunch of ibuprofens. Unfortunately, she did not die, and she ended up in the emergency room. She was cleared, comes to a psychiatric hospital. And I'm talking to her, and I was trying to understand how come you try to end your life. And she said, well, I'm overweight. Nobody likes me. My family don't pay attention to me, and I'm bullied in school, right? And if you really stop to think about what she said, what she's really saying is, um, there's something wrong with me, and that's why my family don't pay attention to me. Okay, and I'm being bullied because I'm being overweight. So I had to take a minute and say, well, have you ever considered the possibility that you're being bullied because these kids are sick, right? Or they're bad, or they're sadistic, right? Or they're insecure. Have you ever told your parents that you feel ignored, that you feel abandoned, that you feel unappreciated, because you're translating all of this input that is coming from the outside toward you as there's something wrong with me, right? So that's kind of a microcosmos of neglect, right? That as you grow up and you don't express your feelings about how you feel in terms of your relationship with other people, you perceive neglect. And perceived neglect, especially when it comes from your parents, is not necessarily real neglect, but it's perceived as such, right? And it's not going to stop until you say it, I'm feeling neglected, right? But for kids, it's extremely difficult to talk to their parents about how you feel about them or how you feel about what they're doing. It's a lot easier to translate it into there's something wrong with me. And that's extremely damaging to the soul. And we carry that to some degree all of our lives. Now, not all neglect is bad, right? Okay. But if the kid perceives neglect as something always negative, right? Let me give you an example. If a kid is throwing a tantrum, right? And you ignore them, are you neglecting them? No, you're not. You are disciplining by not getting into an argument with the child or giving them a lecture. You're just basically saying, take your time, you need some space. That's what we call calculated frustration, right? And we all do it. You are a coach, right? You teach kids how to play different sports. So you sometimes know which kids you have to frustrate somewhat, right?
Absolutely.
That is part of raising kids. You have to train them to tolerate that frustration and to develop skills for it. But the problem is when the frustration becomes the only tool and it eventually gets perceived as neglect. You don't care about me. You only recognize the bad. You don't recognize the good, you know? So we have to balance that so the kid develops some sense of security, and if so they feel that they can take the risk, right? Or letting people know, I don't like what you do. I don't like how you treat me, you know? I don't deserve that you ignore me,
Mm.
right? Because if you don't, those patterns continue to be repeated over and over and over again.
And
So,
what does that look like in an adult then, if you take it forward?
well, if you think of it as you and I have talked about this before, think about growing up with carrying a ball that you don't want anybody to see, right? You're little, you'll be giving a football that says inadequate, and then you believe that you are what the ball says. It has a label says inadequate. You're inadequate. So what do? You start hiding it, right? You don't want anybody to see the ball. Okay. And then you run with the ball for the rest of your life. You know, not allowing anybody to see the real you because you believe that the real you is inadequate. So the chronic neglect leads to you feeling that you're not worth anything. And then you're an adult, and then what do? You cover it up. You try harder, right? You become sometimes perfectionistic,
Mm.
but extremely sensitive to criticism and rejection, right? And you don't allow anybody to see your real emotions because if they see it, they may see the inadequacy. So I don't want anybody creating closeness with me. So you become distant. You create relationships, but they're distant, okay, and they're superficial until you learn that that ball does not belong to you. But when you come to somebody like me or a psychologist or a therapist, and the therapist tells you, you know what, give me the ball. It does not belong to you. You said, no, I'm not going to give you the ball. That's all I know.
Mm.
If I give you the ball, I have nothing, right? So you end up in the concept that we have talked about before. You end up in the bubble of misery with your little ball that you don't want anybody to see. And the longer you stay there, the more comfortable you are with your misery, and then you don't want to get out. So the whole process of therapy, in some instances, requires how do I extend the hand to the person in that bubble so they can take the risk, okay, of taking a peek outside and find out that the whole world is not thinking of them as being inadequate. They think of themselves as being inadequate and they feel so ashamed of themselves that they don't let you close.
Mm. So a lot of self-imposed limitations because of that feeling of inadequacy.
Absolutely. And,
Mm,
and but again, everything is a matter of context and degree, right? How much and how often. So a lot of people have a lot of that and have a lot of problems. Some of us have less of that and we have less of a problem. But to some degree, we all have this self-doubt, right? I mean, it's not like we're born self-sufficient and self-valued, right? It's a process of learning. But the best process to help a child grow up to be self-secure is by providing the environment that is limiting in terms of rules and empathic enough to recognize their assets, right? And the freedom to take some risks. So that balance is not easy to achieve, especially in modern society, right? Because it's a lot of work.
mm. It's funny
And
as you say that, my coach ears pick up. When people ask me I was a very successful, very lucky as a coach. Never had a losing season, won some championships, things like that. And I tell people, I said that's part of what I did. I saw what people wanted to achieve, the individual kids. I recruited the team to support that, gave them all the opportunities, was never critical, but we had my rules. You had to achieve certain things. It was amazing how kids would flourish and start performing on their own and develop all this. I mean, to me, the beauty of it was watching them grow and become confident in their skill set. Not winning games had nothing to do with it. And it sounds
correct.
it sounds very similar, the process of that. How do you support that? How do you give them the opportunities and give them that support? Look at their failures, but not and criticize, be critical, but not criticize, and build upon those things.
Well, it's a calculated frustration, right?
Yeah.
And you
Challenge them.
recognize it. Yeah. There's a little bit of that anymore, right? I mean, we have become a society, especially in industrialized countries, where we limit the ability of the kids to take risks. We limit the ability of the kid to fail, right? And if I have to go back in my history as either as an individual, as a physician, as a friend, the most that I've learned in my life has been from my failures.
Mm,
You
absolutely.
know, I mean, yes, it feels good to succeed, but that's a very superficial, time limited, right? I mean, and I can't help go back to talk about values, your ability to be caring and loving and kind and compassionate and giving that drive whatever you do. And it's not driven only by what you give to others, but what you give to yourself and how you balance that, right? Unfortunately, we are taught that we have to empty ourselves to the world, right? We have to give everything in the last second, even our life, for somebody else. And I'm not necessarily in favor of that. I think that we have to keep half for ourselves and half of the other group of people and friends and people we love. Hence the only you, right? And we will talk more about that in the future. But that's what the concept of the only you comes from, meaning that you can only give what you have. If you don't know what you have,
Mm,
meaning your values, you have nothing to give. You're a taker, right? You take the recognition and the love and appreciation you get from the world, but you don't know what you have to give. You don't even feel self secure to give it, right? So it becomes very important that we introspect into understanding that if we are to give ourselves to the world, we better know what we're giving, right? And it's not my ability to be a doctor, my ability to be a dad, or my ability to be a friend. What I give is my values. But my values have to drive what I do. And I'm valuable when I'm doing nothing because the values are mine, they're intrinsic, right? Unfortunately, people think that the values are they only give you value when you're using them.
mm,
It's not the fact that you use them, it's the fact that you have them. that make you a valuable human being. And we talked about this before. Invariably, when I go and talk to kids and adults every day, and I ask them, what makes you valuable? Invariably, 100% of the time, people will tell me, I'm a good painter, I'm a good friend, I'm a good husband, I'm a good son or daughter, I get good grades, I'm good at painting, I'm talented with music. That none of those things defines anybody. That only defines what they do, not who you are. And your values define you. And I think that we have devalued our values, right? I don't think that we really recognize enough how important they are. And in during this time, during the pandemic, and now that we're starting to get back into some sense of whatever normalcy is, which I think is a great opportunity to reframe, But I do believe that there is a point in which we're going to have to reassess the concept of values and performance, right? And how do we balance those? Because if we did not learn during this last pandemic that how vulnerable we are, you know, how lonely we felt, you know, how angry we got with each other because we couldn't communicate, how politicized the process got to the point that politics became more important than humanity. If
Mhm.
we didn't learn any of that, I mean, we might as well just get another virus next year, and keep going at it. Because this was an opportunity for us to reframe ourselves, to come out of the other end as more valuable people with better values.
To that point, when we started with the neglect, you're talking about children, and now talking about COVID. This last year, did that end up being more of a positive for them because they had to be around their parents or their siblings and be homeschooled, or do you think it was more a detriment because they lost a year of education? Is it possible that this forced homeschooling has actually allowed some of these kids to be less neglected than they were before?
I think that when it comes to kids in schooling over the last year, the evidence we have so far shows that it was not good for kids. All right. And it was not good for kids for a number of different reasons, and it varies depending on age. But everything that has to do with vulnerable kids, for example, kids that have attention deficit disorder, kids that have anxiety problems, kids who have depression, kids who are being abused at home,
Mhm.
kids that are being neglected at home, the stress that is brought in from being in a box, right? Is not variable for these kids. They just couldn't handle it, right? So you can see that the kids who have been uh, in these circumstances, I can tell you for sure that over the last year, the number of suicide attempts and suicide completions have gone up.
Mm.
The number of violence among kids has gone up. The number of deaths from opiate use has gone up, right? The number of women and men in abusive domestic violence relationship has gone up. The increase on alcohol and drugs has gone significantly up. So, as a consequence of being put in a box, the coping skills that the population has had forever were wiped out. You did not have the opportunity to hide from your abuser, right? You were put in a box and you weren't paying attention, and nobody was paying attention to online schooling. I mean, if you go back and test all these kids who were doing online schooling, they're all going to fail.
Mm.
So, for practical purposes, we lost a year of schooling for these kids that they will never regain. There's going to have to be some way of approaching these things. And I think that we're going to continue to see a significant spike on divorces coming up. I think that they're going to be a significant spike on bankruptcies and financial stress in a number of families. You see, everything we did to prevent and to help the people who needed help, both financially and socially, for the last year and so, including the most recent COVID relief package, is time limited, right? But the consequences of not having the ability to cope, the increased abuse, the increased neglect, the increased alcoholism, the increased suicide, the increased deaths from opiates, all of that is going to linger. This is not going to uh, disappear because we have more money and we have more vaccines, right? So there's got to be a planning that needs to happen to anticipate these things. I can assure you that in a year or 2 years, we're going to be talking about the consequences of COVID like a surprise, right? Why is this happening? We shouldn't be surprised, and I always find it fascinating because we never managed businesses like this, right?
Thank God.
I mean, we manage business by having a vision and a mission, and we have planning and anticipation and interventions that we have to follow. So when what I find fascinating is that when there's money in the middle, we're very good at it. When there's people in the middle, we're not very good at it. So it's going to be fascinating to see what's coming into whatever the new normal is going to be like.
It's interesting you say that because from economics, they talk about the factors of production, land, labor, and capital. People forget labor are people, and investing in people is pretty important. It's not just about other things. And to your point, then from an economic standpoint, from a social standpoint, sociological standpoint, what do you think the next year or a year from now, after COVID, is going to look like? And what challenges do you think we really have to be aware of, since you say it's predictable?
Well, they're going to be, I mean, let me start with my business, the business of behavioral health and treatment of serious mental illness. There's been a lot of neglect, if you may, chronic neglect. And there are a lot of sociological, biological, and social and psychological reasons why this happened. But we always had a shortage of services available, right? We always been the stepchild of healthcare. He's like, we kind of like you, but we don't like you type of thing. So the shortage of psychiatrists before COVID, in particular child and adolescent psychiatrists, was tremendous, right? In the last 10 years, probably half of the psychiatrists in this country have turned 65 and they're starting to think about retirement. They're not being replaced, right? And so now we have in family medicine, for example, we had 16,000 practices that closed during COVID in the United States, right?
Wow.
So, so the availability and the accessibility of services is going to be seriously damaged, right? There's not enough medical students to replace the people who are moving out. Medicine has become very stressful, and not only with physicians, but nurse practitioners, physician assistants, nurses. Everybody's thinking about maybe I should do something else, right? And I really find it fascinating how we were all treated like heroes back in March, April, May last year, and that kind of went away, right? Because now the heroes need a lot of development, they need a lot of money, need a lot of growth, and the demand for services is going to be significantly higher than the availability of services, right? And economically speaking, that creates pressures, right? And it creates price pressures because accessibility becomes pricey, right? And the way the system of health in the United States is so fragmented that, I mean, you're having the payers, all the insurance companies, gonna have to fight for accessibility for their population. So it creates a whole chain of problems, sociologically speaking. Um, and then we have the issue of the demand for kid services, right? Because we're going to have a significant increase on stress-related um, uncovering of disorders that were dormant, right? Let me give you an example. Let's say that you have a family in which one kid's attention deficit disorder is identified, and the other kids have a little bit of attention problems, but now with the pandemic has become very evident, right? So they're going to need services. I'm particularly concerned about how much we have neglected psychologists. I think the psychologists have traditionally played a tremendously important role in taking care of patients with health, mental health care issues, and we have kind of moved them aside of the clinical services because payers have decided not to reimburse them adequately. So there are
Mhm.
a lot of issues that are going to be coming up. I think that there's going to be opportunities that we need to take advantage of, for more nurse practitioners in psychiatry moving ahead and providing better more services, physician assistants. So I think that's going to open up. I think that's going to be a good thing, even though physicians have always fought, you know, allied health professionals and other professionals, licensed professionals who prescribe. And then you get into the niche issues, among different professions. I think that's going to be particularly problematic in mental health, but it's going to expand to all care, right? Unfortunately, our healthcare system is based on reimbursement for services versus prevention and outcomes, right? Let me give you just a basic statistic, and this is something we've known for a very long time. One third of the patients in medicine, right, whether they're being treated for diabetes, hypertension, or depression, a third of those patients miss 10 doses of medication a month, right? Now, just think about the size of the healthcare system and think about the consequences of people missing 10 doses of medication a month. Let's say the patient has hypertension, right? And goes to the doctor and tells the doctor asks, are you taking your medications? And the patient says, yes, I am. Well, obviously the patient is not telling the truth because he's missing 10 doses, right? One out of three. And the blood pressure is elevated, right? And the physician is going to spend an average of 6 minutes with that patient, right? During that follow-up visit. So what do you think the physician is going to do? He's going to do one or two things. He's going to increase the medication the patient is partially taking, or he's going to add another medication, right? So if you calculate the cost of patients' partial compliance with medications, right? Then you start thinking about the waste in the healthcare system, right? How many billions of dollars that represents across the whole healthcare system. And that is assuming that we believe that the medication compliance fixes problems when it does not, right? Because if the patient is not taking the medication, let's say we are sure they take him. Let's say the patient tells us that they're not taking the medication and we work on their compliance, but they're not changing their diet.
Mhm.
They're not exercising. They're not losing weight, right? They're still drinking alcohol excessively, right? They still smoke. And they come and tell you, well, doc, the medication is not working, uh, give me something better. But in 6 minutes, you don't have the time to counsel that patient about the importance of lifestyle, you know, and personal health habit changes that need to be provided. The same thing happens in depression, the same thing happens in diabetes. So the waste, okay, is not being measured adequately, if you may. So those things are going to get even worse, right? Because I mean, we have discussed this in the past. Medications do not treat any disorder. They treat the symptoms associated with the disorder. The treatment of illness is much more complicated than taking pills, right? And it requires a partnership with the patient. Now we're going to have more stressed patients that want quick solutions. Actually, that is the motto nowadays, quick solutions, right? Doctor, I want you to fix me. Well, I can't. I don't fix things. I give you options and you have to follow them so you can have a more functional life. But everything is it's like with cars nowadays, right? I remember growing up, I used to I used to love mechanical stuff, and I used to undo cars and put them back together. And I have friends who used to do it together. We'll put out a motor and change things and whatever, right? And you change things and you fix things and you figured out things. Cars are not fixed like that anymore.
Mm.
You just take one thing apart, change things, right? There's no creativity on fixing anything. It's just dump it and change it. And that is a lot that has happened nowadays that I think we need to start thinking out what is going to be our new normal like? What what do we hope for?
Do you think people can even really ascertain that when it comes at least to medicine? I mean, most people, I mean, I was fortunate. I grew up in a family of physicians. Obviously, most of your people in your family are physicians. You've been around for 30 years, but most people's association with doctors is so fleeting, or they, rely on the doctor on one of the TV shows, who may or may not be qualified to really get their information and to understand that relationship. What's the solution to that for an average patient?
Well, you see, we have to start somewhere and we have to start with education. Okay, we need to educate. Just like we talk about the only you, we need to talk about the only body you have and the only one you're going to have for the rest of your life. And you need to treasure it and you need to treat it with all those values of kindness and respect, right? And not abuse it. But we don't hear those things until I don't know, become an adult, right? So why don't we tell that to the kids? Why don't we spend more money on self preservation of your own body and how do you go about doing this from kindergarten on and keep being repetitive about it, right? You see, we invest a lot of money in educating people to know facts and to problem solve, right? But we don't invest enough money on values and self respect, including the self respect toward yourself as a human being, as a body, right? So performance is king. We sacrifice everything for performance, right? I mean, I find it fascinating when I hear um, people talking about we're behind China on math. Okay, so what? Does that make you a better, I don't know, human being? Because you, as a group of people, I mean, who are we competing against? And what are we competing against for? What's the price? So if the price means we're going to stress ourselves to the point that our body's going to be chronically inflamed and we're going to be chronically depressed and chronically fatigued, because that's what happens when you get stressed, you get inflammation in your body, right? There's going to be a point that the curve is going to move downward, right? And we're starting to see some of that already. I mean, just from COVID, we lost some longevity, right? Just because the number of people who have died. So there's going to be a point in which our body is not going to be able to tolerate the stress and the inflammation resulting from it. And there's a lot of base of evidence in terms of the inflammation that occurs under chronic stress. Our body was not built either by God or nature to be under chronic stress situation. Stress is supposed to be short lived. So we really have to dedicate some of our time and thinking in terms of where do we want to see the kids who are being born now? Now, what did we learn from this experience? I mean, it's a little late for me at my age to be thought anything like this, right? But we really have to reinforce the idea that the kids are owners of themselves. I tell the kids all the time, and they look at me like if I'm crazy. I tell them, and I tell this to adults too, you're the only person you're going to go to bed with and wake up with every single day of your life. Everybody else is borrowed, right? You're not borrowed. You own yourself. And we end up treating the world better than ourselves. And I'm not talking about money. I'm not talking about favors. I'm talking about being caring, loving, kind, compassion, and understanding with ourselves. I tell the kids, and they laugh at me when I say, every time you wake up in the morning, you have to give yourself a hug. Like if you're a friend you haven't seen in a long time, and you have to tell yourself, we're going to have a good day today, right? Because if we're expecting that somebody else is going to come and tell us that, we've lost. We really have lost, because if we are going to live for the appreciation and recognition from the rest of the world, we already lost.
Mm. Well, our life is the greatest gift. We should treasure it. Being this person that was in sports for a long time and worked with professional athletes, or actually, hopefully, as someone we're going to have on the show here soon, listening right now, who spent 11 years in the National Football League, beating himself up. As you know, with Kyle Kingsbury, the people we've talked in the past, Kyle was an MMA fighter. I trained him for many years.
Yeah.
And even the self abuse I put myself through physically, and the special operations guys I know, um, there's that external locus of self, but also that perform. The value, as you said, is not as being the human being. It's the performance that you can make your body achieve in the pursuit of winning a title, um, completing a mission, or whatever it is, instead of just the value. And to that point, I think I mentioned it to you quite a few years back. They started having a huge attrition rate in the special operations community, especially in the JSOC level, the tier one levels. And I think I believe it was Stanley McChrystal at the time, took $100 million, handed it to them and say, go fix this. But the caveat was, do not look internally, look externally. And they brought in experts in health and nutrition and recovery and psychology, and the support mechanisms they put together for these people is something that is truly unparalleled. And everything changed. They had a really low divorce rate that had skyrocketed to the 60 percentile, dropped back down to the 20 percentile. People were not being lost on missions. People were not being lost by silly things. It completely changed the community because they focused on recovery, on values, on support, on basically the opposite of what our mythology with these people are. They're the toughest, baddest guys there is. They can gut through anything. The solution was to know, give them what? Compassion, empathy, support, help. Then and only then did they actually really start performing at the highest levels.
It does. It does true for everybody. I mean, I think that I mean, after doing this for so long, uh, having compassion and empathy can take people a long ways, as long as you're being sincere with them. I mean, extending a hand. Um, and you know me. I mean, I'm not soft. I tend to be particularly assertive, especially when it comes to kids. But I can be empathically assertive, and one day we'll talk about what that means. But I can put myself in their shoes and understand what they need at the moment, right? And very often, the last thing they want is somebody to feel sorry for them,
Mm,
because they already feel sorry for themselves. If you want a kid who's been abused and is feeling sorry for himself or herself to get angry, feel sorry for them. Okay. That's when neutrality becomes tremendously important. So, something that I always found fascinating, because I've seen people in the um, special operations, military, professional sports, and they're very proud people. Okay. And they allow you to get close to them if you have enough empathy,
mm,
you know, because um, we are all we, we're very protective people. We don't want people to be digging into our emotionality, right? But if you can create an environment of safety, okay, people will trust you, right? But you also have to trust them. Uh, because the worst thing that I find sometimes when I deal with people who are very hurt is to be intimidated by them,
mm,
right? Um, because and this is part of the psychiatric training. How do we approach someone, right? Uh, Makes a world of a difference in terms of them trusting you, attacking you, or attacking themselves, right? So that fine line has to be walked by professionals. That's where we get into seriously ill people. But in general, most people are going to have a little bit of that. So we have to be willing and able to listen, right? Listen empathically, extending a hand. And that is something badly needed in this country today because everybody's talking past each other.
Mhm.
Nobody's trusting anybody. Everybody's angry. Everybody's trying to hook you into the argument so you can be proven wrong. And that's a prize. If I can prove you wrong, I won. You won what? I mean, that's the whole point, is that purpose. We have lost purpose. The fight has become the purpose.
And how do you think we get that back as a society, as individuals? What's your take on that?
I think it's going to take some time. I do believe, after what we've lived over the last 4 years, that most people, okay, who we consider um, distant, angry, uh, to some extent, um, rejecting of anything that is different to them, okay, I would say 90% of those people are reachable, okay, if you listen, right? And if you empathically guide them toward the idea that I don't have to love you and I don't have to like you, but I can understand you, right? And I respect your idea. People would change slowly if you're respectful, right? I mean, the same thing happens on people who are at the other extreme, right? There are wanting to have everybody accepting everybody. And everybody who doesn't accept everybody's wrong, right?
Mm.
Which is the other extreme, is that um, everybody has to be accepted. No, everybody has to be respected. Not everybody has to be accepted. Not everybody has to be loved. Okay. We have to be able to respect this agreement, right? And I see it. I mean, I see it every day nowadays with issues like um, white supremacy, gender issues, and I'm going to two different extremes, right? Is like, you're bad, you're different. No. Um, and I see it with kids all the time. We have to be able to say, I respect you, okay? But I don't have to love you. And sometimes I don't have to like you. We don't have to fight you either.
Mm.
And I've said this before, the moment that you get hooked by an argument, right, that has no purpose, you've lost, right? Because now the whole point is who's right and who's wrong. And when it
Actually,
comes when
it's
it comes
funny.
to these issues, nobody's right and nobody's wrong.
Yeah, it's interesting you say that. It actually circles back to values. Not just your personal, but what is the value of this discussion? What is the value of this? Is anybody going to benefit from this? If the point is simply an ego fest, there's no point.
I see this a lot with kids nowadays. They come and tell me, my parents don't accept me, right? And it could be for a multitude of different issues. It could be gender issues, it could be lifestyle issues, it could be drug issues, you name it, right? And then I had to say, well, why should they? And of course, the kids get very upset, right? Why should your parents accept you anyway? Oh, because they're my parents, they're supposed to love me. So you're basically saying because they don't accept of your choices and your lifestyle, they don't love you, right? So what you're saying is you parents have to bend all of the traditions and history and values to accommodate you.
Mm.
Why? Now that sounds a little shocking, and my own kids hate it when I say things like that, right? Because they're gonna say you're gonna get canceled. Okay, whatever. It's not about getting canceled. It's about why should anybody, right, change their values because of another human being? So what I usually end up telling the kids, listen, settle for love, right?
By the way, that's great saying. Settle for love. Wow, how
Yeah, settle for
fantastic.
love. Don't get too high, with your demands that you have to be accepted. That's a process. That's going to take time. But I can assure you, in 90% of the cases, your parents love you. They may not like you, but they love you. And as I've said before, anybody who has children knows, right, that you can love dearly another human being and not like them, especially when they're teenagers. So, but the kids get confused with the idea if they don't accept me or they don't like me, they don't love you, and that's not true. Okay,
Do
and
you
I
think
think that parents need to hear that too.
do you think that also gets back again to your point about values? It's love is or the capacity to love is a value. Understanding that that's different from it's more of a base level concept than specifically accepting, right? What is love? And it is a value. And how is it a value versus an action that somebody does?
Well, yeah, I mean, you we can get into the definition of value, and there are many of those. I mean, the definition of love, and then there's many of those. Uh, but it's love. Love requires a level of trust, okay, and it requires a level of communication, right? That you can allow yourself to be in the hands of somebody else, right? Is a very profound level of commitment.
Hmm.
Now, here's where, and you've heard me say this before, love is the promise that cannot be kept because you have to live it every day. And we have fallen into the trap of believing that if somebody tells me they're going to love me forever, they're going to love me forever. That's pretty much only true for your kids. You're pretty much going to love them forever, even though you don't like them, right? But when you're in a relationship with somebody who's not your child, right? You better get up every morning and say, today I'm going to love you every day. I mean, all day. But you, my love, will have to be able to tolerate not knowing if I'm going to love you tomorrow. And that's extremely difficult for for us humans to do because we depend, okay, on the safety of tomorrow, right? So they need to know most likely I'm going to love you tomorrow. But what if I wake up tomorrow and I don't love you? Well, we have that conversation tomorrow, but today be secure that I love you with all my heart, and I'm going to work at loving you all day. And if we do that every day, relationships may last longer, right? Than to say, I'm gonna and kids say this all the time, I'm gonna love you forever, I'm gonna marry you and have your children. Then you marry, you have children, and 5 years you haven't said once that you love that person. So love is a lot of work. Is not a gift that you give somebody into the future, right?
But it's also based on that capability, that value, the ability to love. And that's why,
Correct.
as you said, you must have that first for yourself and have it in some abundance in order to give it to anybody else.
Exactly. That is the point, right? You can only give love if you know what love feels like. And you can only feel that if you truly, honestly love yourself.
How often do you find somebody who doesn't or is totally incapable of loving themselves?
Very seldom. All right. I mean, the question is, are there bad people out there? Yes. Are there sociopaths and psychopaths out there? Yes. And I see them. I see death penalty cases all the time. But there are certain people that are not born with the ability to recognize love, to love themselves. And that's people with autism, right?
Mm.
Because they don't have the ability to recognize the emotional interaction. That creates a whole other set of problems. But autistic people cannot recognize the emotions like we do. So there is a whole concept of the biology of love and interaction and trust and all of that we're going to spend another program talking about, in which we recognize, right, that there's a biological base to it. There is a need for love. There is a need for empathy. There is a need for emotional connection. And we learn that when we see people who are not biologically capable of it. Okay.
Interesting.
Yeah. So it goes beyond the heart, you know?
Wow. Because yeah, I mean Maslow's hierarchy of needs, even Glasser's, basic needs, all those type of things that talk about love and belonging in there. That's interesting. You say that there's a subsection of our society who doesn't have the capability from a biological standpoint. That's really interesting. I was not
Yes.
aware of that at all. That kind of blows me away, quite frankly.
And because of them, we have learned a lot about the biology of emotions, right?
Hmm.
Because if you're born without the neural connections to recognize empathy or recognize um, other people's emotions, that creates a whole set of complications in terms of their sense of safety, right? Because they may feel you being intrusive when you're not being intrusive, right?
Hmm.
And that can create all kinds of emotional issues. So that is for another talk. But autism is a fascinating illness from the biological point of view, but a devastating illness from the emotional point of view.
Hmm. Yeah, I've actually spent some time when I was teaching at the one school with kids that were on the spectrum and things like that. It was a very enlightening experience, and yeah, taught me a little bit more empathy than I came into the program with, quite frankly.
Of course,
you know.
of course. Well, we're getting close to the end.
Yes, again, once again, people, please interact as much as you can. We're going to be doing more of these live shows as well as the normal podcast, in addition to some educational webinars through Dr. Patino's practice and some other things that we'll be doing in the future. Please subscribe, please like, please let us know in the comments what you want to hear about. Again, this is your show. It is the only you, and we truly mean that. We want to hear from you, give you the information you need to hopefully make your life a little bit better and hopefully increase your empathy and awareness as we move along in this life and through the next year, especially post COVID.
Thank you very much, Vince, and thank you very much for the audience, to the audience for listening to us and our concepts. And we hope that you leave the program with some wisdom in terms of how to take care of you so you can give yourself to the rest of the world as a happier human being. Thank you very much for listening.